Integrative health versus homeopathy, and how do these modalities compare? My name is Dr. Erica Steele. I'm a holistic doctor in family practice. I have 6 degrees in my field, and they're all in the natural healthcare space. And I have training in homeopathy as well as integrative healthcare, but you probably knew that already. Okay. So hopefully this will not be super esoteric. We'll do our best. So integrative health is more of a masculine approach. It's more relating to your thinking, it's logic, reason, decision making. You're using lab tests, you're using a clinical the name of it escapes me at the moment, but you're using a process to be able to determine and prioritize things for the patient. So it's more of a leadership sort of role you're guiding a patient through. Whereas homeopathy is far more feminine, it's more energetic, it's really relating to your emotions. In fact, when we make a recommendation in homeopathy, it's based off of the bioenergetic frequency. So it's based off of the psychologicals of the patient, how the patient's emotionally being, their general symptoms, their peculiar symptoms. So it's a little less tangible than, let's say, an integrative health, which relies more on the Western medical model. Homeopathy is more Eastern, even though it originates out of Germany and also India. There's a lot of homeopaths in India. It has a very energetic experience. I'll give you an example. A patient will come in and they'll present, let's say a child will be crying, they've got a cold, a fever, etc. Whereas in a integrative health practice, they're going to test them for influenza, they're going to test them for COVID, they're going to test them for these things, and then be able to give them whatever appropriate remedy is necessary. So whether that is, an antifungal or an antiviral, etc., they're going to give that to be able to help with some of the symptoms. Whereas in homeopathy, they're going to present, and let's say that child is really clingy to their parent while they're sick. That lets us know that's a little bit more towards pulsatilla, because pulsatilla, as a classical homeopathy, is more, that patient is going to express more of a clingy person. So whether that person has, let's say, a fever or they have a cough or cold, whatever, they are going to use that single remedy. Traditional classical homeopathy does require about a 2-hour case taking. I don't do it personally in my practice anymore because my practice, the volume of patients I have just doesn't work. However, traditionally you would ask all these questions and you would get it down to one single remedy, and you give that patient that remedy. They'll have maybe some symptoms with taking the remedy over the next 24 hours, but then their body heals itself. It's really based off the principles of attracts like. So like energy, so the pellets, the homeopathic pellets have an energy to them, and then it matches up with the patient, which has their own energy, and then that heals itself. And so homeopathy is very misunderstood in our Western culture and our Western mind, because we've got to prove it and it's got to be in a study. And actually Samuel Hahnemann, who was the founder of homeopathy, he did a lot of scientific studies and provings, and he would give all of these pellets to people and follow them and evaluate how they respond. And so he created a materia medica, which has all of these provings in it, and there's softwares and all kinds of things to make it easier, but it's very fascinating how these pellets. So let me talk a little bit about how homeopathy is made, because I think that's important. So they'll take an original substance, let's say arsenic as a for instance, and they'll shake it up. They'll dilute it through succession and dilution. So they'll dilute it down till it's no longer that original substance, and now it's just the bioenergetic frequency behind it. So it's not harmful in any way. So if a person takes it and they don't need it, it's not going to harm them. Now, in my practice, I use a lot of complex homeopaths, and complex homeopaths use multiple homeopaths together, and they create more of a complex substance. And that works a little bit better in my style of practice. If you're interested in a classical homeopath, I can make some recommendations for you. Otherwise, if you want to use homeopathy, there's some really good books out there that can teach you how to use homeopathy in your home to be able to treat your children, because it's very safe, effective, and it's helpful as long as you get the right one. And whereas homeopathy is pretty safe to practice at home by yourself, with integrative health, you need a provider to be able to run lab tests and be able to evaluate what it is that you do. So hopefully that helps. The different learning about the distinctions between integrative health versus homeopathy. They both are beautiful, and I use them together as a team. They work wonders. My name is Dr. Erica Steele. I'm a holistic doctor in family practice.